These lovely people to give us a bit of space. Thank you. So Lee Miles is going to be giving a talk on the science of drug testing. I feel privileged. I have been able to work with Lee over the last 5 years a few times. And he's a biologist and a geneticist, mainly based in Melbourne, and I believe a keen surfer. If you don't mind, Lee, take it away.
Cool, thanks Ronnie. Okay, can I get a hand up for anyone who's been subjected to a roadside saliva test? Okay, that's maybe just more than half, which is surprising. I thought it'd be more, but... Okay, so, for many of you who don't know, the Victorian roadside drug testing program was the first in the world to introduce randomly selected mandatory drug testing. So we have a lot of data from that, and a lot of the things I'll be talking about come from Victoria, and I'll try to make distinctions if there's anything different that I know. So first, it was introduced in 2006 when the Road Safety Act was amended. And basically what it says is that any motorist that tests positive for cannabis, methamphetamine or methylene dioxymethamphetamine, which is MDMA, at any detectable level will be prosecuted as a drug driver. That is no, doesn't matter about impairment or anything. That's a completely separate charge. This is just about if you have it in your system. It means it's drug driving. Recently, I believe New South Wales have now brought in another test that includes cocaine, but I won't be talking about that. So in this talk I'll focus mainly on cannabis, THC, and also the amphetamines. So how it works for those who don't know is when you get pulled over randomly or at a stop, you have a first initial test that gets done. Usually this is called a drug wipe 2, that's the cassette. And generally that tests for THC and the derivatives of methamphetamine or MDMA. It's the same test for both of them, it can't differentiate. That is a strip test that you rub on your mouth, rub across your tongue. Sometimes they get you to do it on your cheek. You're pretty sensitive. And if that comes up positive, then you get taken to the van or you get taken back to the station, get arrested. And then you have to give a saliva sample, and this is instead of a swipe test, this is where you have to dribble into a little tube and they collect your saliva and then they split it and put it into an electronic device. The device is called a Corsart Rapsican, and that is quite sensitive as well. And from the data what we know, it's interesting that if you're a drug-free driver, it's very quick to get your saliva. It only takes 2 to 10 minutes and the machine spits it out very quickly. It takes about 6. But if you're a drug-affected driver, it takes about 20 to 30 minutes to get your saliva out, just because most drugs have a drying effect in the mouth, and the actual machine takes longer to read it, so they can almost always tell if you're going to come up positive. And so, if you come up with if you get done on the first test and you go back to do the second test, in Victoria, if that comes up negative, you're free to go. They'll still send your saliva away to get tested from a lab, but if that comes up positive, you're still not charged. That's different in New South Wales, where if you come up negative on that second test, they send your saliva away. If any detectable presence there, that will come up and you'll be charged. So the saliva test they do in the labs is incredibly sensitive compared to the ones they do in the mouth and the electronic one. The scale is different. So really you don't want to come up on those 2 tests. Now, when I was prescribed cannabis, I asked my prescribing doctor about driving, and they said don't drive impaired. But that if I got pulled over and it came up positive, that I should request a blood test, because that should be able to tell the amount of metabolite for cannabis compared to the active ingredient, THC, and then a judge would throw it out. I don't think that's actually real. and probably doesn't really matter if the judge got it, but it would be something very interesting to find out if that's happened or not. So with THC, that's the main active ingredient in cannabis, and it gets metabolized to 11-nor-delta-9-tetrahydrocannabinol 9-carboxylic acid, which is THC-COOH. And so when you do a urine test, they are always basically testing for the metabolites of THC. When you do the saliva test, they're only testing for the active ingredient. It's not testing for... it doesn't test, and it doesn't normally last very long in your mouth, but I'll get on to that as well. So, saliva is a mixture of proteins, fats, salts, different liquids. It's generally very acidic, or slightly acidic, sorry. And can anyone guess how much saliva we make a day? A litre? Anyone else? Half a litre? So we make on average between half a litre to 1.5 litres of saliva a day. And that there's many things that dictate how much saliva we make. Smoking, that will cut down the amount of saliva you make. Dehydration, the time of day, how much sleep you've had, a lot of things. And so it's been known since the 90s that certain drugs are present in saliva after you've consumed them, and that some of them are present in concentrations in your saliva that would kill you if they were in your blood. So they get more concentrated than anywhere else. And so the original concept with oral testing was that they're circulating in your blood, and then they actively get transported into your mouth by your salivary glands. And that the ratio they call, it's a saliva to plasma ratio. It's called the SP ratio. And that is the amount that something gets transported into your mouth is completely dependent on the type of drug it is. And the quantity of drug is also dependent on how much saliva you produce. The more saliva you produce, the less concentrated it is. And so a lot of the drug tests work, the swab tests work on concentration. So the more saliva you end up producing, the more of a dilution effect you have, the less can get detected. And these are all about thresholds. So once you drop below a certain threshold for these antibody immune tests, which are the strip tests, it won't bring up a positive. It shouldn't bring up a positive. So with THC, the amount it can detect is equivalent to 1 teaspoon in an Olympic-sized swimming pool. So pretty sensitive. And if you look at the companies that manufacture the drug tests themselves, it's sometimes hard to find how long they think that the drugs will be in your system or detectable, because it's highly variable on the person that's taken them. And it's highly variable on the test used. Each test has a different specificity and different efficiency at testing them up. For Victoria, there's at least 8 different tests that the police are allowed to use. They generally only use 2, but they can use a whole range of different tests they have at their disposal to use. Okay, so now we're going to get into specifics here and how things get into your saliva specifically, and I want to start with THC. So when you consume THC in any way, most of it, 65% of it, is excreted through your feces, and 20% of it is excreted in your urine. And most of that, it's about 90% of that, gets out of your body within 5 days through various mechanisms that get hydroxylated, carboxylated, broken down. And there's a lot of different metabolites that we create. There's up to 18 known different metabolites that are identified in urine specifically. And this is done by the liver. THC is metabolized by the liver, by hydroxylation, and by cytochrome P450. So there's differences in urine and there's differences in feces. In the urine, you primarily get 3 main metabolites, and then in the feces you get the different metabolites called 11-OH-THC. So there's different ways that your body processes it to get rid of it. Now, it's very well documented in the literature that, and not very well known in the public, but THC in oral fluid is exclusively there from contamination or contact with your mouth. There is no transfer of THC into your mouth. And we know this because since the 70s, in the early 70s, there was experiments where they had radio-labeled THC and they injected it into patients, and then they tested their saliva with very sensitive testing means, and they couldn't find any THC in your mouth. And this was further confirmed in the 2000s, where they take dronabinol, which is a name for synthetic THC in the pharmaceutical context. They put it inside a capsule, and when someone swallows that capsule and they test their saliva, it's also not detected in your saliva. And so this is an interesting note as well, because very recently, in the last month I believe, the TGA have stopped selling THC in capsules because it doesn't come up on roadside testing. And so what that means is that when you're tested for THC in your mouth, it's an indicator of how recently you used it. It has no relation to impairment whatsoever. And it's very different from the tests they do, like workplace testing in urine, which that can test, stay in your system for a very long amount of time. And so for all the tests that they do for roadside tests, THC is actually one of the fastest ones to go away in theory compared to everything else. Everything else normally stays in your body a bit longer. But it's very well documented that is an incredibly variable on each individual person how long that's detected for. It's not much is known about that, but I'll get into a little bit of what is known. And so we know some things about how it gets trapped in your mouth, and we know that it's from direct contact. And so the amount of THC that gets contaminated into your mouth, that is a time and dose dependent manner. Meaning the higher potency THC that you have that comes in contact with your mouth, the more you have in your oral cavity. And with time, the longer it's been since that contact means you'll have less THC in your mouth. So the method of consumption also makes a very big difference. As I talked about, pharmaceutical capsulations, anything that doesn't touch your mouth, that gets into your body, won't come up in saliva. Also, if you eat cookies, any kind of edible, compared to smoking, you'll get much less THC in your mouth. And we're talking when there was a study in the early 2000s, and they looked at brownies with the same amount of THC as cigarettes, cannabis cigarettes, and they found at 24 hours later they could detect 1 nanogram per mil from the brownies compared to 10 nanograms per mil for the smoked cannabis. So that's a 10 times difference. There's also studies looking at vaping compared to smoking, and there's been 2 studies looking at this, and both studies have found that there is higher THC concentrations in your oral fluid after smoking compared to vaporized. And that is surprising when they also showed that you get more THC in your system when you vaporized, but it just didn't make as much contact with your mouth. So it doesn't get there as much. And so what we what we know or can also extrapolate from this is the way you consume cannabis, the way you let it interact with your mouth really dictates how long it's going to be detected for and how much. If you smoke and hold it in your cheek, in your mouth, that's going to increase the amount that gets deposited there, and you're more likely to come up on a test. So there are certain things that can affect how long it stays in there, and this is things like food, drinking, mouthwash, even just water. If you rinse your mouth with water before a test, the amount of THC goes down. And so it can go down, but normally that doesn't mask your recent consumption. It still would trigger a test. A lot of the studies that do this, they use very sensitive methods, and they can tell exactly how much. They don't normally use just the strip tests. So when you smoke weed, you normally get a dry mouth as well. You get less saliva, so that pushes it up, makes it more concentrated. So there are a number of things you can do to kind of help mitigate this. You should eat something after you've smoked and before you're going to drive. Obviously don't drive impaired. But, having good oral hygiene, brushing your mouth, brushing your teeth. When you brush your teeth, scrub your tongue. Scrape your tongue as well on your teeth, because the THC gets trapped inside your tongue in these little pockets. The test they use, they get them to drag it across your tongue. This acts to squeeze out the little pockets that are deposited in there. And so the more you do this, the more you scrape your tongue, the more you brush your teeth, the more you drink and eat, that will slough off or take out that deposited THC in your mouth. Stay hydrated, things like that. Something to keep in mind as well, so I mentioned mouthwashes and everything like this, that there's no thing that will completely take it away if you've just smoked. You still have to have a bit of time to get out of your mouth. What we do know though is that THC is incredibly lipophilic. It loves fats. It's almost insoluble in water, but it really likes being in fats. And some of the most things it's soluble in is things like refined soybean oil, refined sesame oil, refined olive oil. So when you keep that in mind, that having those oils in your mouth, THC might preferentially go to those oils and then spit them out. That's what we can kind of extrapolate from these studies. So in summary, your oral cavity and THC in there, it's generally regarded as evidence of recent consumption, and normally it has the shortest detection window for all the drugs tested. There is studies showing that it's generally correlative to your blood THC levels or blood levels of any metabolite, but that's not necessarily the case, it's just inferred. Some people can be detectable for days and days after they have smoked, and other people 6 hours. It can't be detected anymore. And so, as we know, it's not an indicator of impairment, but I'd just like to read out this little quote of a 2009 paper where it says, "The erratic distribution of THC in oral fluids and the magnitude of intra and inter-individual variability following even standardized cannabis administration may preclude its use as a meaningful marker of acute intoxication or impairment." Basically saying it's rubbish. Okay, so now I'm going to move on to talking about the other major class of drug they detect for, and that's the amphetamines and amphetamine derivatives. And those Currently they test for methamphetamine and 3,4-methylene dioxymethamphetamine, or MDMA. And while I'm talking about these, I'm also going to include some of the data that we've got from just straight amphetamine, which they don't test for in those first roadside tests, but a lot of the work has been done about amphetamine specifically, and they're very, very similar in terms of how they get processed in your body. So once you consume any amphetamine-like substance, they get into your blood. And so all of these substances are very weak bases, and they're very small. So they can diffuse through cell membranes, lipid layers, tissues, any biological tissue really. They get very well distributed through your entire body. And they like to go in places that are slightly acidic. Anything is more acidic than your plasma, they will get into and they'll start to accumulate. And so with the saliva's are slightly acidic, amphetamines are weak bases, and you get much higher concentrations of any amphetamine in your mouth than you'll ever have in your blood. And often they're able to be detected for much longer in your saliva than they even are in your blood. They kind of form this like depot there. Again, similar to THC, it's dose related. So the more you consume, the more often you dose, the longer it's going to be detected in there, the higher concentration will be detected in there. And also, again, time dependent. The longer time you've had since consumption, it will slowly start to go down. So, first I want to talk about how amphetamines are removed from your body, because unlike THC, which is purely a contaminant, they are getting taken from your blood continually and put into your saliva. And so the major route of excretion is in urine. So your kidneys take it out of your blood, they filter it out, and they put it into your urine, and you get rid of it. And this has been known since the early 70s. Most is excreted in the first 24 hours. So up to 74+% is excreted unchanged. And then around about 23% the next day, 3% the day after, and 1% the day after. And most of that is just unchanged molecule for those who want to think about drinking their pee. Methamphetamine, again 90% of it is eliminated in urine. There's various products, but most of it just gets eliminated unchanged. Similarly, and that is most likely, most of it occurs within the first 24 hours. Similarly with MDMA, 24 hours, only around 34% gets excreted, but a lot of it is metabolized into different things. And generally, they would say that should come up negative in a urine test around 48 hours after. But there's many factors that can contribute to that. So there are a number of things that affect how quickly your body eliminates it. It's highly dependent on the acidity of your urine. Similar to saliva, the more acidic your urine is, the more your kidneys will put into your urine. And so they've, again, known since the 70s that if you are able to acidify urine, there's some things they use like ammonium chloride. The more acidic your urine, the more quickly you get rid of it, and it's very dramatic. So in the 80s, it's been shown that, and well understood, that if you acidify your urine with ascorbic acid, which is also known as vitamin C, you decrease the amount of the absorption of some antidepressants and amphetamines, and it's mentioned in the literature that you shouldn't be, if anyone has these medications, they shouldn't be taking large amounts of vitamin C, or it might counteract the medicines. And this is kind of well known anecdotally for ADHD medications. People talk about if you have vitamin C before your ADHD meds, they don't work very well. So there are some foods that are known to slightly affect your urinary pH, but generally food alone won't won't change your pH. You have to take something to do that. The foods that if you take something like vitamin C, there's foods that can kind of help. They would be things like cheese, eggs, bacon, meat, lentils. Generally not fruits though. Fruits don't help with it, or green vegetables. So there are a few things we can learn from this or to put into practice. This would suggest that if you've taken any amphetamines, that once you're finished with that session, you're about to go to bed, for example, you should start taking high doses of vitamin C. Whether that's 1,000 milligrams or 2,000, generally that's up to each individual person. And then the day after, the next day, you should be taking that same dose every 4 hours. And that should allow your body to remove it very quickly. You probably still have to wait 24 hours. And you should probably buy some drug tests to just test yourself just to be safe. But that will allow it to go out much, much faster. Things you should also do is hydrate yourself very well. The more urine you produce while doing this, the more will get flushed out. Eat well. Eating makes a big difference, and sleeping makes a big difference. So there's also some things that affect how much saliva. Well, before I move on, the term drug driving is if you have any detectable drug in your system. So if you remove all the drugs from your body by peeing them out, technically you can't begin for drug driving because it's not in your body. But with saliva, in a lot of the studies, they test different cassettes and different tests to compare them to each other. They all noticed that methamphetamine concentrations were lower when citric acid was used to stimulate saliva production. And this is because the more saliva you produce, the lower the drug concentration is because of this dilution effect. And citric acid is one of the most well-known substances to make you salivate. It's easily accessible in candies, it's in the supermarket, but unfortunately it only lasts a few minutes, so it's not really suitable for helping in this situation. And there are a lot of misconceptions with how to get around a drug test, and I've heard a lot of people saying that they should wash their mouth out with vinegar, specifically apple cider vinegar, and I would caution against this. There is a study in 2013 that showed that vinegar itself caused false positives for a whole range of different drugs, and sometimes this was for an extended period, for like over 30 minutes after the person had rinsed their mouth with vinegar. And it's something specifically with vinegar itself that it interferes with the immune reaction, and they come up positive. So I wouldn't suggest vinegar, but anything really that you wash your mouth out makes a difference. Of all the other things that people use, cleaner, water, milk, none of those things will prevent a positive test from coming up. It will lower it a little bit, but it won't prevent it. But yeah, rinse your mouth out regardless, and try and have good mouth hygiene would be the way to go with THC. So that's all I really wanted to mention. There should be time for questions, so I can open up if anyone has any questions. Let me start with you. Can you repeat the question, sorry? So the question was, is there any difference between smoking compared to eating? And yes, there is. Generally, when you eat anything containing THC, it doesn't stick to your mouth as much as smoking. Some of the studies, there looks to be like a 10-fold difference when you smoke compared to ingesting. Yeah. And I'll just mention, the studies that do that, they generally get the people to eat it over a certain period. So if you don't, and chew quite a lot. So if you don't chew much and don't keep it in your mouth much, that will probably go down. Yes?
Sorry, I missed. Okay.
So that question was about the oils that I mentioned, and if it was for counteracting the roadside test. I mentioned those because they're the substance that THC is most soluble in. And so if you have the contamination in your mouth, they're the things that will most likely move from your mouth into another liquid, which you can remove.
I have a question about capsules. If you take capsules and then you burp or you have a mouth ulcer, will that increase the risk of roadside testing for THC?
So that question was about capsules. If you have taken encapsulated THC and then you have either burp or have mouth ulcers. And so I'm not too sure about the burping. You'd have to, if you had fluid like actually coming into your mouth, that's a potential for contamination, yes.
Or vomiting, for example.
Vomiting, yes, there's potential for that to then coat your mouth. Mouth ulcers, yeah, look.
And reflux.
Reflux would be included in that if it came into your mouth, yeah. The mouth ulcer thing is a really good question. Any cuts that you have in your mouth, if you're bleeding in your mouth, if you have poor mouth hygiene and have a lot of build up there, you will get blood in your mouth, and that blood can contaminate your mouth. Whether that will affect how much, if it on a roadside test, that's a different question, but you can get detectable things from blood in your mouth, yes.
I was told by a member of the Victorian Police that if you test positive for alcohol under 0.05, that they often don't do a marijuana test. This has been challenging for, but I've never found anything to back that up.
The question was, at least in Victoria, if you get breath tested for alcohol and it comes up under the level that they won't test for drugs, the legislation, that's not written into the legislation, and I have been tested for both. Yeah, it's really down to the individual police officer's discretion. Yeah. That was about the questions about fisherman's friend lozenges, hearing that they might help. Personally, it's all anecdotal, and that's the problem with the THC test. It's very variable. There's nothing in those lozenges that would prevent the test. If it was alkaline, it can alkalize your mouth, but you would still put it into your saliva. Your saliva glands, it's actually the pH of your saliva glands themselves, and they're located right down the bottom. So it's similar to the vinegar thing. A lot of people have used that and not been tested positive, but it's purely because the personal variation, and everyone's mouth's different. Yeah, unfortunately.
Lee. I was carrying on the questions, but I've just got to throw this in because I don't know if you mentioned it. But you can buy saliva testing kits, and they go down to 12 nanograms, and I think on the road it's 10 nanograms. And so I've been testing myself once a week, and just
5 nanograms. Yeah.
is it 5? Sorry, 5 at the first swab. Though, the first
swab now it used to be 10, and a couple of years later they brought out a new sensitive test.
So commercially it goes down to 12, and I've literally overdosed myself to the point of being unconscious just to see if the capsules would work. And it does work 95% of the time, except when I refluxed.
And also, if you're making your own capsules, you don't want to have your hands touching the outside of the capsule, because they will then contaminate your mouth. Yes?
In regards to, you said there was a difference between, say, smoking and jointing and vaping. Were you talking about vaping flour or?
The question was in regards to the difference between smoking and vaporizing, and with the vaporizing, if it was an oil cart or a dry herb vaporizer. So for these studies that did that, they were looking at dry herb vaporizers. Yeah, they haven't looked at carts yet. My feeling on that would be that this is just my feeling. So that because the carts, in those carts, the THC is in a medium that they're highly soluble in, they probably want to stay in that media rather than getting into your mouth as much as they would, say, when they're burnt and vaporised like that, like with smoking, but I don't know.
They taste much less.
Yeah, that's right.
I've heard different answers to this over the years, but can you just go over what the police force's own guidelines are, if any? Aren't they? For 12 hours or so.
The question was about like the police guidelines for timing. I'm not sure they have. You're talking about after you use a substance. I'm not sure the police really have guidelines. That it's not their prerogative. I mean, you can get information in some places, but the problem they've got with giving specifics is if they give a specific and that's not correct, you know, people follow those rules. So I don't think there really are too many guidelines around timing. Generally, it would be considered for amphetamines it's 48 hours or 24. It's 24 to 48, but and THC that can be anywhere from 6 to 3 days. So the question was about using, if you use coconut oil with the THC in it to make cookies, if that will reduce the amount. And yeah, so just having edibles compared to smoking already reduces it a lot. If you chew those cookies less and swallow them a bit more whole, that would again bring it down. But yes.
In regards to timing, so you've got a long-term consumer versus short-term consumer. Would the times be radically different or just a little bit different into when you get a positive or negative result?
So the question was about a long-term user versus someone that's just started using, if that changes the timing. A little bit, because if you're using every day, you get a build-up because you're just getting more in your mouth all the time. Yep. So, yeah, a little bit, yes. But if you have really good mouth health and hygiene, and you know, do a lot of things to mitigate that, in theory, it should be the same for everybody. Yeah.
Lee, we've got one to two questions. Time for that.
Okay.
I know this might not be your area of expertise, but why hasn't there been a class action against the government and police for testing something for roadside that isn't actually, they can't really prove what it's there?
They can't really prove what, sorry?
Since they can't prove that we're impaired, how have they got away with having that law for so long? It might not be your area of expertise, so
So the question was, how come there hasn't been some kind of like class action against the government because the roadside testing isn't testing for impairment, and that's because in the Road Safety Act, or the amended version of it, it doesn't talk about impairment. It talks about if you have any detectable drug in your system. There's a separate charge for impaired while driving, but this is specifically relating to consumption of drugs and having any in your body detectable and driving. So you can't go against them for that. That's what the black and white paper says. The writing on the sheet. Yeah. One more question, yes?
I take description every night, and I think it was 12 hours after the fact, I think it's fine. Is that just because it's 12 hours later, or without, you know, what you're saying?
So that question, the lady takes THC oil every night, and she got tested yesterday, 12 hours later, it didn't come up. And that's because of the time thing. Generally, you know, most of the people that smoke, at least when they first came up with these tests, it was about 7 hours after that it didn't come up. Now the test is much more accurate, so it's a bit longer, but yes, it's just because you're using an oil, you're swallowing it quickly, and that amount of time has passed. Yeah. Cool, well, thanks everybody.
We're going to just reset and then we'll have the next two panel guests in a moment.